So, Dr Shoba John, welcome back to our Scotland. It's really lovely to have you here. But can we go back to when you first visited Scotland? Tell me about that.
Thank you for having me. And I first came to Scotland in 2007, if I recall correctly. It was just after Scotland had extended its vanguard smoking ban to restaurants and pubs. And I had come with a bunch of Indian city leaders, Deputy Mayor of Mumbai and some of the other cities, to come and have an exchange with the Scottish enforcement teams on how it's being done here, and to learn and take some of those lessons. And it was quite a good learning. We walked around, visited the pubs, checked on some of it, and then you'd be glad to know that many of those cities, including Mumbai, has gone smoke-free. So it was quite a good exchange, and that's what brought me first time to Scotland. I thought, that was Scotland's leadership in tobacco control, which I think it still continues to keep hold and sustain.
And more recently, you've been back in Edinburgh working with the university. You've just completed a PhD. Could you tell us a bit about what you've been doing here?
So my PhD has a focus on non-communicable disease governance broadly, but with a specific focus on tobacco control and its governance. But looking at how when all our countries participate in the WHO Framework Convention on Tobacco Control and its meetings, how when countries participate, what are some of the challenges they face, both within governments in terms of intersectoral coordination issues, as well as challenges between different parts of the world and their priorities. So that's a broad focus of my examination of the tobacco control governance.
And what have you learned? What would you advise Ash Scotland in terms of some of that work that you've been doing?
One of the key findings from the research, it actually emerges from a contrast I had of the tobacco governance with the nutrition governance. And the significant finding and what sets out tobacco control, and particularly WHO Framework Convention on Tobacco Control, is a provision in the treaty called Article 5.3 popularly, which keeps the tobacco industry from tobacco control decision making. Nutrition governance doesn't have that provision. So that, in terms of challenges for governments, when they take decisions on tobacco, the protection of Article 5.3 measures they could leverage, that really stands out in contrast to food governance, where industry is often at the decision-making table, and it complicates things for governments to take decisions in the interest of public health.
I think that's the heart, for me, of Article 5.3, because the tobacco industry is all about profit, and public health is about people, and people having the best attainable standard of health. And I've seen so many ways in which the tobacco industry is an enemy to public health. Could you reflect a bit on that?
In Asia, it's interesting that it's seen as the biggest market for all consumer products, but particularly tobacco companies have been training their guns. Partly because regulations are still coming up, but some of the governments are taking very good steps in that direction. For instance, Thailand has got very strong tobacco control policies. India, my home country, is quite good in regulating tobacco advertising. And as you would know, we have the world's biggest movie industry, Bollywood. And so it has been very bold of Indian government to restrict display of tobacco products and tobacco brands in movies. And so that's one of the world's first across different film industries, Hollywood doesn't have it. So Bollywood has taken the lead, rather Indian government has taken the lead in regulating it. So except with, editorial justifications and quite a few restrictions and stumbling blocks movie producers have to go through if they decide to keep any display of tobacco use. And just 2 months back, they have further extended it all the OTT platforms, so all the Amazons and Netflix of the world. If they show a film in India, they have to then mask any tobacco scenes or tobacco brands. So again, that's a world first from India. Several other Asian countries are similarly taking measures. Nepal has got very large pictorial health warnings. So we're getting there, but industry is also equally active, also with the newer tobacco and nicotine products like e-cigarettes.
So what are they doing with those new products, do you think?
Quite a bit of so there's no production of electronic cigarettes, at least not known in India, but we do get electronic cigarettes from other countries. In about a year to two back, Indian government banned electronic cigarettes and all its variations and forms. So that's, again, quite a bold step. Enforcement is slowly picking up. We have challenges there, but some of the states within the country are doing really well. The companies are still trying to promote it through internet, for instance, and a lot of word of mouth, peer-to-peer marketing among youngsters. Those are some of the newer venues the industry is trying to push the product to younger people.
When I look at the way they market e-cigarettes here in the UK,
yes,
it's almost following the same playbook that the tobacco companies followed with cigarettes.
Yes,
decades back.
Absolutely. I do see a ray of hope, though, for all our countries on the electronic cigarette side, particularly with the disposable electronic cigarettes coming in. Among the younger population, and definitely in India, there's great awareness about the environment and plastic use. And, so if we are able to communicate the harm from the disposable e-cigarettes, the plastics, to that population, I think that could be an additional way to address e-cigarettes in addition to the public health arguments we already have good evidence for. Yeah, so I see some early initiatives trying to engage with the youth with the environmental harm message, and therefore, I know quite a few schools have initiatives similarly for soft drinks like Pepsi and Coke on similar grounds that it leaves plastic waste behind. And I was surprised to see how younger people respond to that better than those from our generation does. So I see hope there.
One of the things I see is that the industry is playing off countries against each other, because in the UK I've heard people say, we've got really strong regulation, and they would be surprised at India saying, no, we're just going to not allow these, we're going to ban them. But it's not unusual globally, is it, that nations have taken that decision?
Almost 50 countries now have got either a ban or very strong regulation on e-cigarettes. And I think, particularly for countries, low and middle income countries, just don't have the luxury of experimenting on a product on which evidence is inconclusive. So that's why they have taken the precautionary approach and preempting the entry and flooding of the market with these cigarettes. I think we've got some very good examples, of countries that perhaps have not banned the product, but are now waking up to the increasing rise in youth vaping and youth e-cigarette use, like Australia, which has just tightened some of the regulations around e-cigarettes. And I think Scotland has a great opportunity there. in terms of looking at some of those countries who are in a similar situation in terms of tobacco prevalence, smoking prevalence, declining. And you also are similar in terms of having an end game strategy. I was very delighted to hear that Scotland was one of the early countries to set an end game goal in as far back as 2013. And you have a couple of more years until 2034 to bring down the prevalence to less than 5%, if I remember correctly.
Mm-hmm. Yeah. So we decided in 2013, you're right, we were one of the very early adopters globally, that in 21 years' time, a baby born in that year would grow up and be living in a community, wherever they were in Scotland, where adult smoking rates were 5% or less. So that's what we're trying to work towards. And that's why we are calling on the Scottish Government to keep showing leadership, keep being bold, and do things that are going to make a difference.
So the countries that have set an end game target, if you look at them, there are some very interesting characteristics that they share. One is all of them set out a really clear strategy for the country, and a bold strategy, I would say. And secondly, they tend to take some really strong, drastic steps in getting to that target of under 5% prevalence in tobacco use. A very recent example would be of New Zealand, which has upped its game and is, reducing its 6,000 tobacco retailers to under 600 in about 2 years' time. So countries are taking really ambitious, drastic steps with the hope of getting down the 5% prevalence target. So I think there's an opportunity for Scotland. I think are you about to look at your new strategy, isn't it? It's in the works.
Yes, the Scottish Government's thinking about strategy. It's planning to launch it this autumn, and it will be a 5-year strategy taking forward the 2013 plan that was put in place.
Okay. So I think that's really opportunistic, because the next 5 years would be really crucial. And if I understand correctly, at the current pace, there would be almost a 16-year lag time to get under the 5% prevalence target for Scotland, for impoverished areas in particular, isn't it?
Yeah.
So there is that need to catch up on the speed, but there's the opportunity to take some really strong measures, such as on tobacco availability in the communities, particularly in the most deprived communities, specific strategies addressing inequalities. The other characteristic of endgame countries is dealing with novel products, emerging nicotine products. So like e-cigarettes. Australia is a very good example of that. Like Scotland, it had its smoking prevalence coming down. E-cigarettes was allowed to be around with some restrictions, of course, but they are seeing an uptake in e-cigarette use among young people, and therefore have clamped down on that. Because if we don't plug that gap, then all the gains from the smoking control measures, this can detract from that. So I would say, I'm hopeful that perhaps Scotland's new strategy would also have some bold steps addressing those products, or a separate strategy. Another interesting feature which we see in many of the countries that are strong on tobacco control are cross-sectoral action within the government. So getting on board some of the other sectors of the government to also take tobacco control related measures, either tobacco sensitive measures or tobacco specific measures. So tobacco sensitive measures are like, say, for instance, if there is Department of Foreign Direct Investments, or Ministries of Finance, they taking measures that would proactively help and contribute to reducing the prevalence, such as through increased taxation. How is Scotland doing on the Scottish tobacco taxation? Would you see some scope for that?
Tax at the moment for tobacco is a reserved issue. It's set by Westminster.
Yeah.
But one of the things that Scotland's been doing, and I was really proud of, and we found out about this last World No Tobacco Day, is we are supporting farmers in Malawi to move away from tobacco as a crop and grow food crops and macadamia nuts.
Yeah.
And that money is kind of going back into stimulating small businesses and alternative livelihoods, particularly for women in Malawi.
Yes.
And I think Scotland has a sense of itself as a global citizen.
Mm-hmm.
And that's really important, because one thing I hear from various international colleagues is that the tobacco industry targets, and it targets people living on low income, it targets minorities, it targets gender, it just very much goes for new consumers. And sometimes they use rhetoric and they use things that are said in the UK in the context here to try and disrupt regulation and legislation elsewhere in the world. I don't know if you've come across that.
So interesting that you mentioned Malawi, because Malawi, as you know, is one of the two most tobacco dependent countries in terms of tobacco production, or at least the industry tries to make it believe that way. And the Scottish Malawi partnership is a good example of even the potential for Scotland to be having that kind of an exchange with other countries in a similar way on tobacco control. Some of the lessons that we're learning here, how can that be useful? What are some of the lessons there that Scotland can learn from? It's interesting that sometimes some of the low and middle income countries, maybe for cost effective purposes, actually have more integrated tobacco control. Just last month, I was doing some work in India with Indian states and on electronic cigarettes. And interestingly, the ban on electronic cigarettes is being enforced in several states, not under tobacco control law. We do have an electronic cigarette ban nationally, but many of the states are also leveraging the Drugs and Cosmetics Act, which regulates nicotine. And so what brings them additionally to the enforcement workforce is the entire drug controllers and the inspectors of that particular department. So that's where I feel sometimes there are lessons that can be learned through that kind of a partnership. And I'm hoping perhaps that's another area where the new strategy can add that additional component if it already doesn't exist. And many times Canada has done this through its civil society. So the government, through its strategy, would empower the national civil society to engage with partners in other countries to facilitate that knowledge exchange and learning. And so that, I would think, would be a really good, bold step for Scotland to do, both to benefit its own tobacco control, but also to showcase its work.
So you think maybe Scotland can be strong on tobacco control measures and share its experience, but also in being a global citizen can learn from the creativity and the ways of achieving some of these measures internationally and bring that back here?
Yes, absolutely. We often hear about South to South learning, but I think that's a concept of the past. I think there's room for all of us to learn across countries, different aspects. And I sometimes find some of the most resource-starved areas come with the most creative ideas. And they're replicable elsewhere, because that works for everybody. You save precious dollars and pounds by getting more people to do tobacco control. And nutrition, actually, interestingly, which has been part of my PhD research, they actually have managed to do this much more, even globally. So if you would see a typical nutrition program, is not exclusively done by Ministry of Health. I'll take the example of Bangladesh, which I looked at closely. They have Ministry of Agriculture very much involved, Ministry of Food Security involved, disaster relief involved, even Ministry of Industry is involved in some of their fortification initiatives. So the advantage is that then health ministries don't have to try and do it all by themselves, and don't have to struggle to find resources and budget. And in each of these cases in Bangladesh, the respective ministry, they have budget line now for nutrition interventions. So that's a good example we can take from another country and bring it to tobacco control, across our countries. Yeah.
And again, something that we're doing in Scotland, and it's a nice size to do, is joining up across some of those topic areas. So the NCD Alliance Scotland, which is led by the British Heart Foundation in Scotland, brings together people working on diet, high-fat, salt and sugar foods, tobacco and related products, and alcohol, and shares expertise and learning. It's happening at so many levels, and I think knowing that we can learn from local communities and their experience and their solutions, that we can learn from each other in different fields, and that we can learn globally from some of the ways that people have innovated and tackled a global multinational industry.
You said something very important about cross-pollination between different health-harming industries and our response to it, like food, tobacco, alcohol. Now, if you look at it, very simply put, all of them are promoted through advertising. And in some ways, tobacco control has walked that path slightly ahead of some of the other issues, at least in some of the countries that we know of, because of the FCTC and Empower initiatives. So, alcohol could similarly benefit from a similar initiative. And by joining our learnings and our resources, it even enables the governments to then look at them together, and to have that ripple effect, learning from tobacco and taking that lesson to apply to some of the, like junk food advertising. Most countries are yet to get there. But on tobacco, I think a sizable number of countries, if you look at the FCTC reports, you can see advertising bans have been on the increase, and there's good uptake of that particular intervention. So can we take that to inform other health harming industry promotions, unhealthy commodity industry promotions, and similarly learn from some of their initiatives? Like, if I may take the example of alcohol licensing in Scotland, there's a licensing mechanism here in Scotland for alcohol. For tobacco, we currently have a registration system, and I understand that Scotland has done some work into it in recent times. So can we look at the alcohol experience of licensing, not to necessarily replicate it, but what worked for it? What kind of mechanism is needed? Are there areas where the two licensing regimes can cross paths, or at least share human resources? How do we envisage the legislative changes needed? But there's scope to learn from that, for instance, from alcohol to tobacco, even here. And I'm hoping that the new strategy again would have some of those, would move forward some of those legislative changes that you might need.
So from your perspective, if you had any advice for the Scottish Government about the new Tobacco Action Plan, if you had any advice for Ash Scotland about the next decade and time beyond, what should we be thinking about?
So first of all, congratulations on completing your 50th year of action here in Scotland and serving the Scottish public and beyond. And I think you've done an incredible job. I myself came to know about your work through the International Civil Society Alliance, working on tobacco, the FCTC. So, and the work that Scotland has done, I think Ash Scotland has also played a role in taking it beyond the borders and familiarizing it for people like me to know about it and come here and look at those examples. So, wonderful job for your next decade, both for Ash Scotland and for the country. I think one is to really get that bold strategy out a day early because time is ticking and there is some catching up to do, isn't it? And secondly, in terms of very bold measures, I would say reducing tobacco availability needs to be really front and center. Another bold step, I know that taxation is more a federal issue, but maybe there's scope for some levies to consider. Quite a few countries, particularly in Asia, interestingly, have done some very creative taxation around tobacco. Thailand being a very good example. It levies 2% of tax on tobacco and alcohol. It's a health levy, and that's then channeled for health promotion of all non-communicable disease risk factors. And there's a health promotion foundation set up which manages it. So another example which I learned from, I think if I recall, it's Cambodia or Laos, one of the Southeast Asian countries. They have similarly doing a taxation, and a component of it goes for street lighting as well. So it serves communities' need both for public health intervention as well as for other interventions that the local communities need. I know Mexico similarly tried health taxation on soft drinks, and part of that, some of that money goes to public health intervention, and the other for water supplies in low-income communities, because they did have severe shortage of water. So it's a win-win for everybody. For ministries of finance, you get additional income. Ministries of health, you get additional budgets for public health interventions. And then the communities and the people are benefiting both in terms of health and other civic facilities. So I'm hoping again, health levy would be another. It would be fantastic to see some in a very clear action in the National Action Plan.
I think that's a great suggestion. We'll definitely take that one back too.
Yes.
So, Dr. Shoba John, thank you so much for coming today and celebrating our 50th anniversary with us and giving us a lot to think about for the next 5-year action plan for Scotland and beyond.
Thank you, and all the best and more strength to your hands.